Well, thank you everyone for joining us this morning. My name is Jennifer Trujillo, and I'm the Substance Use Disorder and Special Populations Program Manager at Nevada Primary Care Association. Also with me today are Rima Knock, Lindsay Diaz, and Dawn Gench. Lindsay and Rima will present on the HCCN, and Dawn will present on PCMH for the Primary Care Association. Nevada Primary Care Association is a nonprofit organization dedicated to improving access to high quality, community-based, affordable primary health care in Nevada. We provide training and technical assistance to health centers and community partners to improve access to health care for all, especially for the underserved and underinsured populations. To learn more about our training opportunities, please visit us at nvpca.org. You'll have the opportunity to submit your questions today to the presenters by typing your questions into the chat panel. We will answer your questions at the end of the 4 presentations or at the end of the total presentation. Today's session will be recorded and slides will be available to participants. All right. Our overview of the presentation. We want to introduce you to PRAPARE and its benefits, demonstrate how PRAPARE is used with the Community Connector, explain how PRAPARE supports the HCCN activities along with the PCMH activities, talk about some action items, and map out the current workflow that could be used for PRAPARE. After today's presentation, you will understand PRAPARE and how to track your patient's social determinants of health. Also, you will learn about the Community Connector to connect your patient to resources in the community. Social determinants of health is the condition in which people are born, grown, live, work, play, and age. Social determinants of health may be associated with adverse health outcomes. Social determinants of health affects 40% of a person's health outcome. The collection of data related to a patient's non-medical needs using the assessment tool through PRAPARE can accelerate systematic population health improvements, as well as engage patients in addressing their social non-medical needs, such as transportation, shelter, or access to food. The data gathered from the PRAPARE assessment tool will provide the data needed for our Community Connector sites. The Nevada Community Connector is our site to connect your patients to resources in the community. Based on the data gathered in our Nevada Community Connector, we have statistics from the health centers that utilize the Community Connector, and the top 3 searches are housing, food, and legal services. The National Association of Community Health Centers, in partnership with the Association of Asian Pacific Community Health Organizations and the Oregon Primary Care Association, created the PRAPARE assessment. The PRAPARE assessment tool consists of a set of national core measures as well as a set of optional measures. The national effort is to help health centers collect the data needed to better understand and act on your patient's social determinants of health, as providers are increasingly held accountable for reaching population health goals, such as Healthy People 2020, while also reducing costs, improving care, and improving quality of life. The first 9 measures of PRAPARE are the questions asked in UDS. The additional core measures address social determinants of health that the patient is facing in their lives. The PRAPARE Implementation and Action Toolkit Chapter 9 goes into detail about all the measures that PRAPARE can collect about your patients. Some of the PRAPARE measures can be education, employment, language, housing status, transportation, and safety. One of the biggest obstacles for patients to get to their healthcare appointments was transportation. One of the measures used in the PRAPARE assessment tool is transportation. If transportation is identified as a barrier for your patients to come to their health care appointment, you can partner with Regional Transit Authority to offer bus passes or partner with Uber or Lyft to drive your patient to their appointments. The data collected from PRAPARE assessment tool also obtains data for UDS, HCCN reporting, and PCMH certification. Collecting this data is essential because the data gathered can help you have the information and statistics needed to write grants for various programs. There's no wrong door approach to receive information from the patient. Collecting data on the social determinants of health using PRAPARE can be accomplished in a variety of ways. There's absolute no right way, only what works best for your setting. The data can be collected by, at the time of check-in with a self-assessment questionnaire, in person with clinical staff or non-clinical staff, such as community health workers. Incorporate PRAPARE into other assessments, such as the health risk assessments or depression screening, waiting for the provider in the exam room, or after the clinical visits. One idea to use PRAPARE tracking data is to focus on populations such as the diabetic patient population. Almost 10% of Nevadans are diabetic. PRAPARE can collect your patient's data to identify patients who have an A1C higher than 9, missed 2 appointments in the last 6 months. The community health worker can reach out to these patients and schedule an appointment to address the social determinants of health they're facing and create action plan to achieve their healthcare goals. If you are a part of the state opioid response grant, and part of that MOU agreement is to install PRAPARE assessments tool into your EMR. So part of the grant funds will be used is to cover the time spent with your IT departments and any staff in implementing and install PRAPARE into your EMR system. That way that data can be collected and reported out on. Or the second option is to utilize the PRAPARE feature inside the Community Connector tool that we'll go into later in this presentation. Now on to the Nevada Community Connector. With the Community Connector, this site you can use as a one-stop shop to connect all your patients to low-cost or free resources in your community. Today, we're going to go over the basic and advanced features, filtering, understanding the resource business card, sending referrals through the connector, and how to create a patient profile. To get started with the Community Connector, you will go to our website, nvpca.org/community connector, and then you will type in your zip code for the area that you're looking at. That will bring you into the login page. We will create accounts for anyone in your organization. This way you can store all your information and tracking purposes for your patients that you're working with inside the Community Connector. So you'll just log in using your email and your password. This will bring you to the main home page of the Community Connector. And you have a choice of looking for community resources by these tabs that say housing, goods, transit, or you can use the search box to filter out different programs. For this demonstration, we're going to use our training demo, the NVPCA Peer Support Group. And when I type in this in the search box, it brings up over 211 programs that are associated with our training demo. To filter down, because that's a lot of choices to go through for resources, you have the choice of using personal filters, program filters, or income eligibility filters. For my search for the PCA's Peer Support Group filter, I select the language or median, and this brought it down from over 211 programs to 14. This is our business card reference in the Community Connector, and this gives you a summary of what is available to look at the card. It gives you a quick overview summary of what the program offers, its main services, other services, who they serve, who to contact, and the hours of operation. If you choose the More Info button, this goes into more detailed about the community resource, and you can print this and give it to your patient if they would like a hard copy of the information. You can also save your favorite community resources to your user access. You just create a folder and it saves to your username. You can also share this information. So if your patient gives you permission, you can send an email or text regarding the information of the program. You can add notes to you and your team members about the program to save. Like, this is a great site, and you can save the notes. And also any suggestions. So if you know there needs to be a correction to the community resource, you just choose the Suggest button, type in your message, and then the data team will confirm and update if necessary. You do have 3 choices on how to refer your patients on our community connector. The first one is if the resource claimed their program on our site, the request is sent directly to the organization through our site. Or you have the choice of being transferred over to apply on the company site, or see the next steps, such as they might want you to call them instead of going over the web to connect to them. If the program allows you to refer directly from the community connector, you will fill out this form shown, and the information will be sent directly to the person in charge of the resource. A confirmation email will be sent to you and your patient if your patient requests the confirmation to be sent to them. Now we're going to look at the tab on the right-hand side for the people you're helping. This will show you all the people's that you are assisting currently and their profile that you have saved in the community connector. So you have a choice right here where it says get started. You can create a new patient profile with their information. And then over here on the left-hand side shows you the patients that you already created profiles for. Today, I'm going to use my test patient, Jenny Test. And when you pull up her personal info tab, her personal information will be listed on the left-hand side. And next to that is the goals. And goals are any goals you're trying to achieve with your patient for tracking. And you can say you're done, you can say in process, you can say got help, you can add notes that she went to her meeting, and such as. For our goals for Jenny, she has a total of 6 goals. So our community health worker is assisting her with utilities, transportation, education, work, food, and mental health. Also, you can add notes to the goals, which shows right here that Jenny went to our meeting for tracking, and these notes can be shared with your other team members who have access to the site. Underneath the goals, you have the referrals that were made on Jenny's behalf. So right here shows she was referred to our NVPCA peer support group training. And with that, you can add a goal, and you can also add notes to share with your team on her progress of where she's at with achieving her goals. Also on the patient profile screen, you can access the PRAPARE assessment questionnaire as well from the community connector. The only thing is you use the PRAPARE questionnaire on the community connector, it doesn't link to your EMR system's PRAPARE tool. So that's something to decide if you want to use your EMR system for it or use the one collected in the community connector. This is an example of some of the questions that are asked in the questionnaire. And based off of that questionnaire inside the community connector, we have found 79 unique programs that will fit into Jenny Test's profile description. So basically using the PRAPARE form narrows down your search that would best suit the needs of your patient. Also, your patients can sign up for their own accounts. If they do sign up and use the email address that you signed them up with, everything will link together. So anything the patient does on their own will link over in addition to what you're doing for the patient. All right. Well, that ends my 2 presentations. Is there any questions for me?
So if the patient signs up with a community connector and they are doing things on their end, will that transfer to the EMR system as to what the patient is doing, or that wouldn't? Is that separate?
For the community connector?
Yeah.
No, it will not transfer over to the EMR. It will just be kept in the community connector database, what they're doing.
Okay, thank you.
Thank you.
I have a question. With this website, can it be configured to different languages?
Yes, they use the Google language. So there is an option, a feature, you can change it for the language.
Okay.
Okay, well, that's it. I'm going to turn it over to Miss Rima and Miss Lindsay for their presentation on HCCN.
Well, good morning. My name is Lindsay Dietz, and I'm the project manager for Arizona Alliance for Community Health Centers and Collaborative Venture Network. So the presentation today is related with the PRAPARE tool, and we're going to be talking about the Health Centers Control Network and our role, as a collaborative network for the state of Nevada and Arizona. So a little bit of the background, and I'm not going to spend too much time on this. One of the reasons why we're here is because HRSA, who is the main funder for federally qualified health centers, want us to build a learning health system network. And we are here. The PCA, is here, and then we have some other partners, that are available to you guys. So one of the things that we want to make sure is that we are able to support you and provide training and technical assistance in regards to enhancing the patient and provider experience, advancing the interoperability, and using the data to enhance value, right? So the PRAPARE tool is basically enhancing the data, using the data to enhance the value, for your FQHC. So we try to support the health centers and leveraging the use of tools like the Community Navigator tool. And this, of course, is going to help you move toward the value-based care environment. So HRSA, and again, I'm not going to spend too much time, but basically we need to make sure that you guys are enhancing the data and reporting analysis. And again, this is one of the initiatives that, or the reason why we have partnered with you guys today. So includes community consulting on the quality improvement activities. So we are able to provide you the consultation as an external consultant to make sure that you're improving your data, that you're reaching all these metrics that HRSA wants you to do. There is a lot of clinic participating within our network. If you look at your clinic, all of them from Nevada are in red. We have a grant cycle that is 2019-2022. And again, this is basically, leveraging the use of health IT to increase their participation in the value-based care. I would like for you guys to focus on the orange items, and just because I think that these are the ones that are extremely related with the PRAPARE tool, and the reason again why we're here. So we're supposed to be helping the centers in increasing their patient access, through different tools. One of them, could be the PRAPARE tool, and the other one is the patient engagement. So we're assuming that if you support your patient in covering some of those social determinants of health needs that they have, they most likely will be more engaged with you, and they will respond better to the care that you're trying to provide. So do better follow-ups, follow up on their medication, make sure that they come back when, what they're supposed to. The other one that we have, related with this is specifically the patient having access to patient portals. So we see the PRAPARE tool as another way to identify where the patient is at, and what are those barriers that they have to access, the care that they need. And then if we identify those barriers, then what's happening with their patient engagement level? Are those barriers related with the social determinants of health getting in the way, for these patients to be able to engage with you and receive the care that you're, willingly providing to them. So some of these tools that Jennifer just presented is, we're going to be tracking a little bit of the data, and HCCN is also data related. So we want to make sure that we can consolidate clinical data with non-clinical sources. So PRAPARE is a non-clinical source, but we know that if we gather that data and integrate it with some of the health information data, we might be able to run some analysis and get some trends and identify the population that you guys are serving, which will allow us also to do more of the population health management piece that is integrated in part of the value-based care. So one of the goals that we have as a grant is just to integrate at least 3 external clinical and non-clinical sources. So some of you already have access to the Health Information Exchange. Some of you have access to the labs results, within your EHR. So PRAPARE will become that third, non-clinical source that we can incorporate, as part of the data integration goal. I put this one in red because this is a specific item that is related with the PRAPARE, and it's the social risk factor intervention. So we would like to have a higher percentage of community health centers using aggregated and patient level data, while assessing some of the social risk factors. And, most importantly, we would like to support you in developing strategies that will be very well coordinated and more effective while you're trying to intervene, into the life of a patient, and in the patient care continuum. So we have, has a goal specifically, or has a metric, is the number of community health centers that are using health information technology to collect social risk factor data. And this is why we're here. This is why we partner with everybody today, because we want to make sure that all your care teams and everybody involved into the patient care have data available to make well-informed decisions, but most importantly, develop a care plan that it will meet the patient's need, but most importantly, it will improve the healthcare outcomes, for the patients. And this is just, a little laugh. I think that the challenge that you guys face every day as an FQHC is that everything is due last minute. Like all the items are due the day before, and then by the time that you guys are available, to take care of the patient, there's a lot of aspects that that fall into play just right before you're ready to see the patient. So Rima will be talking about this, but I think that this is what I like about this cartoon is that we want to make sure that you keep this in perspective, and that we know that your reality. So we're here as an extra help. We don't want to burden you. We want to alleviate this and make sure that we can share at least the healthcare reality for you at the center level, a little bit at a time. So how do we do it? Again, in our vision for success is through collaboration. We like to collaborate with you. We have been working with your center. There's a lot of things that we have been trying to accomplish and, help you, a little bit into the project management piece, but most importantly, gathering, so many different goals from so many different programs. And this goal is an example of it. We have, as I said before, the HCCN, we have the PCMH, we also have the, the community navigator. There's a lot of people here, but we want to make sure that we become that safety net that would allow you to get, your activities done and everything that you need to complete, but most importantly through collaboration and teamwork. All right, so here I'm gonna pass the torch to Rima. She is, your quality improvement manager, from the PCA side, but she's also the HCCN project coach, assigned to Nevada. So Rima.
So our goal with having health centers part of this network is to strategically assess, plan, implement, and replicate processes and to support the health centers with reaching the health center control network goals that Lindsay shared. Like she said, this meeting is a part of the strategy to support you with your social risk factor integration while keeping in mind the PCMH standards to support you in your quality improvement award efforts. We collaborate with health centers on developing a comprehensive work plan of items that you're already working on that support the HCCN grant objectives, as mentioned earlier. The HCCN coaches like myself support the health centers with creating specific, measurable, achievable, realistic, and timely objectives to advance health information technology and move towards value-based care within your organization. Workflow analysis is done as well to support health centers with best practices seen from other health centers and other organizations. Coaches support health centers with providing project management to the activities and deliverables outlined in the work plans that we work with you on. We want to track, monitor, measure, and report any advances to health information technology while supporting health centers with PDSA and Lean Six Sigma tools to achieve HRSA goals. Thank you. So on a monthly basis, we meet with health centers. We provide bi-monthly HCCN peer-to-peer meetings where all 26 health centers are invited to discuss further on HCCN or HRSA objectives and bi-monthly newsletters to network peers. We also supplement our work with additional HCCN activities. We like to participate with health centers in capturing and validating HCCN reporting to HRSA. We discuss the challenges and barriers with HCCN project objectives, progress on work plan activities, lessons learned, goal advancement, and promising practices seen within health centers in the network and nationally. So all these items we want to help support your health center with moving towards the value-based care and advancing all the health information technology.
Emma, we can no longer hear you.
Yeah, I was just gonna say, so basically what we're trying to do here in HAZA group is just trying to make sure that, show that, and, in a way to show you that, these are not separated initiative. In the end, we are coming together to support you and make sure that you're also successful into the PRAPARE implementation within your centers. There's a whole team, professional team here to, we have your back basically, and we want to make sure that, that you knew that there's a relationship between what Jennifer was just presenting on regards to the community navigator and, some of the resources that they're trying to put together for you and have it available, and then the HCCN, Community Health Center progress reporting and some of the technical assistance that we have been provided for you. Is there any questions for me? Anything, on regards to the HCCN? I know that some of you might be, this might be the first time that you guys have been, that you guys are hearing about it. All right. Well, we'll pass it torch then to Dawn and her PCMH presentation.
Welcome everyone. Thank you everyone else who has already presented, and for those of you that were unable to join us at the very beginning, know that we are recording this, and welcome the opportunity to talk with you in the future about all of this. So I wanted to wrap this up and talk about the patient-centered model of care. And certainly the patient-centered model of care connects all of the different activities and initiatives that we've shared with you today. So the PRAPARE tool, the Nevada Community Connector, the HCCN services with the great hands-on quality improvement support that they're providing to
can you
health centers.
Get a number? Because I'm not done with this SR.
So if we could mute lines, that would be good so that we don't get the background noise, please. So, so I'm going to continue here. All right. So as you may all be familiar with, federally qualified health centers are grounded in providing not only primary care services and your integrated behavioral and oral health services, but a large part of the work that you do in serving the patients and the population that you serve is related to the outreach and enabling services. And that's a term that the Bureau of Primary Health Care under HRSA uses. And as others have addressed, you track and report that information through the Uniform Data System on an annual basis. So the patient-centered model of care really intersects nicely with the work that you do for the outreach and enabling services, but it really touches on all the things that you are required to do under HRSA and the health center program requirements. So the list on the right side, outlines all the different aspects of the patient-centered model of care. And hopefully, based on the comments that my colleagues have made today, you recognize that there's such an overlap in the different initiatives and the action items, work plans that are happening to support you, whether that's the patient engagement, care management, referral tracking based on the different community needs, and population health, just to mention a few. So the staff that you have, whether they're specific to outreach and enabling or all the other members of your care team, really work, as you know, collectively to serve that whole person and meet their needs from a very broad perspective. And so when we talk about the patient-centered model of care, one of the recognition organizations that's out there nationally is the National Committee for Quality Assurance, or NCQA. And there are several other organizations as well. But federally qualified health centers most often choose to obtain recognition from NCQA and demonstrate that they are a patient-centered model medical home and follow the model of care using those guidelines. So what this slide is showing you is that there are multiple criteria or activities that you as a federally qualified health center need to demonstrate as part of your recognition that tie back to the social determinants of health, and thus the just rationale for utilizing the PRAPARE tool, as well as using the Nevada Community Connector as a resource to help you in tracking and meeting your patient needs so that you can improve their care and their health outcomes. So the first core criteria is comprehensive health assessment. So that criteria specifically asks you to be obtaining information from your patients at least on their initial visit and annually, updating that at least annually. And so you can see the list of items from medical history, social functioning, developmental screening, but social determinants of health is certainly one of them. And so to demonstrate that you are a medical home, you have to be conducting these comprehensive health assessments, and you will have to have a documented process. That's what the DP stands for. And you have to have other evidence of implementation. So you show NCQA during your review with them to obtain recognition, how that is documented in the patient's chart. And you also can generate reports to demonstrate that this is accomplished for your entire patient population or the panel. So the social determinants of health, I often see that health centers do a fairly good job with this because of some of the aspects that others have talked about today, like transportation. That seems to be a huge issue for many of the federally qualified health center patients. And food insecurity is another that we often see that is captured quite well and consistently by health centers. The next one, KM7, knowing and managing your patient's population, is an elective that under the patient-centered medical home recognition, you can demonstrate. And so I've seen many health centers use the PRAPARE tool. There's also many that are using resources like the Nevada Community Connector and the reports that can be generated from that tool and how you work with your patients to refer them to the community needs and resources that will help meet those needs. So that's a good correlation and connection to demonstrating that you're a medical home. The next one, CAM21, community resource needs. This is another core criteria, meaning you have to provide the evidence to support this for your recognition as a medical home. And so you have to use information on the population served by the practice to prioritize those needed community resources. So again, producing that list is often generated from the Uniform Data System reports that you already are required to submit to HRSA. But I've also seen, again, lists that are from resources like Nevada Community Connector and specifically the PRAPARE reports as a means to help demonstrate and provide the evidence that you need to meet this core criteria. And then lastly, there is care management. There's an entire standard. There are 6 standards within the National Committee for Quality Assurance Patient-Centered Medical Home program. And care management is large, and it allows you to identify the patients that are of needing the most support from you, and you define that, you generate a report, and then you show how their treatment plan is included within their medical record, and outline things like what the patient preferences are and barriers to meeting those needs. So again, social determinants of health is one of those criteria that health centers use to demonstrate that they meet the core criteria of care management and some of the other criteria that fall within that standard. NCQA has really made social determinants of health a priority. In fact, for those federally qualified health centers or other ambulatory care practices across the nation that have NCQA recognition already, they are in a cycle that's called annual reporting. So every year they have to renew their recognition, and they do that by providing evidence to NCQA on a subset of the criteria. And part of the requirements this year for those health centers with recognition are to share information about these various aspects of the social determinants of health. So I wanted you to see that they're requiring even more from their recognized practices. And so this is something that I think is really helpful for all health centers to take a look at and think about: how are you providing information about the care interventions, the partnerships that you have with the community resources that you refer your patients to, and tracking and utilization of those resources, et cetera. So again, the work that the Health Center Controlled Network is providing for you and with you, as well as the work that we're doing as a primary care association and supporting your work through the Nevada Community Connector. And then, of course, adoption of the PRAPARE tool will really help you to demonstrate that you can meet these requirements for annual reporting moving forward. So I'm going to pause for a second, and I am almost done here, but I wanted to get back to, again, the foundation of being a community health center. And I know I'm preaching to the choir here, but I think it's really important for you to recognize that really the grounding and the history of the federally qualified health center movement is based on meeting the needs of through the social determinants of health, and really linking patients to community resources. So thus, again, thinking about how this ties back to the Nevada Community Connector, the use of the PRAPARE tool, the support that the Health Center Control Network provides, and what the patient-centered medical home and the model of care can support your health center in the work that you're doing and caring for your patients and improving the health of the population. So you hopefully all know that, from the 1960s, when one of the first physicians helped start the movement, they were writing prescriptions for food. I mean, that was a big part of what was happening. So that really, that basis in grounding the work of a health center in meeting the needs of the patient from a social and community perspective really formed the basis for the health center collaboratives that they started in the 80s and 90s, and all the quality improvement work. Hopefully you are all familiar with the fact that your UDS data are used to compare your work at your health center level with all of your peers across the nation. And so there are quality improvement awards that happen each year. And for patient-centered medical home, there is a specific quality improvement award and incentive payment that your health center can receive if you have recognition. So that is provided regardless of your other UDS data and whether you're trending in the right direction of improvement or not. But if you're a patient-centered medical home, most likely you have many of your clinical quality measures that are improving. So the next couple of slides are really more as additional resources, and again, reminding you of how social determinants of health connect back to the enabling services that you report on as a health center. And there's been some great work over the last 40 years, really. And this is just a more recent work that the National Association of Community Health Centers provided regarding specific information. This is an infographic showing you some different things around how interpretation, health education, case management, et cetera, as some of the enabling services are working. So if you're not familiar with the resources that NAC has around enabling services, this can be useful to you, and again, help you with all the work that you're doing for adopting the PRAPARE tool and increasing the reporting that you do under the enabling services through your uniform data system reporting annually. Wanted to share with you as well, this is from some of the same NAC resources as well around best practices for enabling services. So again, they have just helped to define those different categories. I know that the health centers in Nevada are doing many of these things, and we're trying to support you as the PCA in addressing these services. We'd also be remiss if we didn't talk a little bit about the Uniform Data System, or UDS. And so this is the aggregate data for the state of Nevada based on the calendar year 2018. And the numbers are actually surprisingly at a lower than what we would have anticipated. And so we're anxiously awaiting the 2019 data, which will be out. Normally it's out in August every calendar year. But you can see these are the categories of enabling services that you report on. Again, this is all of the federally qualified health centers for Nevada, not any one specific health center. But it's important that you, again, connect the dots and think about how the PRAPARE tool, the Nevada Community Connector, patient-centered medical home recognition, all tie together to help you in addressing enabling services. And so accurately reporting those to UDS is important. These are some PRAPARE workflows that I just wanted to throw in. Again, these are things that we would work on with you through the Health Center Controlled Network, also with your patient-centered medical home recognition, because there's not one way to do this, certainly, but there are lots of best practices and lessons from others who have done this before you that we can build from and utilize. And with that same note, again, I'm all about not reinventing the wheel. And so these case studies on various social determinants of health with very specific health centers, again, from the National Association of Community Health Centers, I think are well worth your time to take a look at. And that might help you, again, as you work to more completely adopt the Nevada Community Connector and the PRAPARE tool. And then the last few slides, I'm not going to reference exactly, but again, there's just some great resources out there around enabling services, as well as social determinants of health resources. And so I encourage you to think about utilizing some of these, and the two videos that are in the bottom right-hand corner are, again, really good, especially as some very short training tools to help orient and help your staff and even patients better understand some of the things around social determinants of health. So with that, I want to thank you all for joining us and open it up. And I know that all of my colleagues, Jennifer, Lindsay, Rima, and myself, thank you all, and we're all available to answer any additional questions and work on next steps with you. So thank you.
I just wanted to say really quickly, thank you very much for putting this together and sharing this with us. I feel like based on the information we've seen today, it kind of gives us a better idea of how these things can be integrated. I feel like also based on the information that we received today, I feel like it might be a better opportunity for me to work a little bit more alongside our new RN, Rebecca, to try to get some of these things moving forward. I know one of the conversations that I've been having on a frequent basis with Roxana lately is now that things are sort of tapering off with the urgency of COVID and becoming more daily function, and how we're integrating that process now with our regular operation, we'll probably start getting back to focusing on making sure that these programs are working well for our patients and incorporating some of the stuff that we saw today. And I did get a message that this slide deck or the presentation will be available to us, correct?
Yes, most definitely. All of the slide decks will be available.
Okay, that's wonderful, because I feel like several of these slides would be really good for the entire team to kind of see through one of our trainings. Specifically, some of the other individuals that we have that are going to be helping with these processes, like Alberto. It'll be good for me to sit down with him at some point and kind of go through it with him as well. But more than anything, I just wanted to offer my appreciation for you guys putting all this together. Thank you.
You're welcome. And you know we're here to support you, Dave, and all of your team, as well as the other health centers in Nevada. So thank you. I see that there's several other people on the call on the webinar today from First Person. Some of you I don't know, but welcome. Do any of you have questions for us? You know, Jennifer started with talking about Nevada Community Connector and the PRAPARE tool, and then Lindsay and Rima talked about the Health Center Control Network. So happy to answer any questions or receive any comments from others too. So Jennifer, I'm going to turn it back to you as our fearless leader and coordinator with all of this. Anything you want to say before we wrap it up?
Thank you, Dawn. Yes, thank you everyone for attending today. We appreciate you taking time out of your day to learn more about the PRAPARE tool, the Community Connector, HCCN, and PCMH. We will be sending out the slide decks to everyone. And if any of you, I can send out login information for user access to Community Connectors. Start working on it. If you want us to present at any of your trainings regarding any of our services, we definitely can. And with that, I will end this session and look forward to any questions you have. So thank you so much for joining us today.